Welcome back. We are talking in this video about cholesterol management lifestyle. So this is Dr. Stokes with Bread and Butter Primary Care. I have an additional video about medication management, specifically about the statins, and a separate video about other cholesterol medications. But today we're just going to take a brief few minutes to talk about what lifestyle things can you recommend for your patients. This can be a very, very important thing. You're going to run into a whole array of patients when you begin practicing. Some would really prefer just to take a medicine because if they can lower the numbers that way, it's great. Other people are going to be like, I don't want to be on medications. What else can I do? And so we're going to talk a little bit about lifestyle things that can help with the cholesterol numbers. So two main things, pretty obvious: diet and exercise. Diet is really just elimination of cholesterol as much as possible from the diet. Like we've talked about in several of these videos, cholesterol is both made in the liver and it's consumed in our food. We don't need to consume any cholesterol. We make everything we need all by ourselves. And so it's in our food because it changes taste, it's a good texture. People like food with cholesterol. And so the dietary changes are really pretty straightforward. You want to avoid things that are fried, oily, fatty. So usually I'll tell people to avoid fried and fast foods because that kind of collects a lot of those types of things. Processed foods oftentimes have a lot of cholesterol. Animal fats and meats also have a lot of cholesterol, and so those are the things you can avoid. When I recommend dietary changes for patients, I always like to take a graded approach from where they're already at. And so it's not one size fits all for me when I talk about diet changes for my patients. So if they are a person who eats donuts every single day, and that's always what they do, they have a donut every day for breakfast, we might talk about the fact that donuts are fried and that there's cholesterol that's being taken in that habit. And the first time I talk to that patient, I might recommend that they only have a donut every other day. Now that's a pretty crazy recommendation for a doctor to tell someone you should eat donuts every other day. But if your usual is eating them every day, we're cutting your donut intake by half. And so that's a good reduction, and it's something that they can likely tolerate. They don't have to worry about never eating a donut again. And then once they're used to that lower number, then we can say, hey, you know what if we went down to one per week? And then over time, you make these lifestyle adjustments that are maintainable and tolerable. So dietary is pretty straightforward. Decrease fatty foods, fast foods, fried foods. So kind of the F's: fat, fatty, and fast. You avoid those things and you'll get a pretty good reduction. Cholesterol: fresh fruits, fresh vegetables are obviously the best thing. Whole grains as well. So pretty straightforward, standard dietary advice for lowering of cholesterol. Then there's exercise. Exercise is huge for cholesterol management. There's very, very good evidence for the benefit of exercise, and specifically raising the good cholesterol. You can get very good changes in your HDL levels with regular cardiovascular exercise. I was reviewing some of this earlier today, and they've pulled the study data for exercise and cholesterol. And what they found is that the more intense the exercise, the bigger the benefit. But any exercise does have the benefit, and that's something good. Because sometimes the biggest benefit you can make for a patient as far as exercise is going from sedentary to mildly active. And so it's kind of a slope that's curved, kind of like this. It has a steep up and then it kind of flattens out. So if you have a person who's exercising not at all and they start exercising some, there's very rapid improvement that they can improve on their cholesterol. Now if you take a fairly active person, so here's the slope coming up like this, they're already right here, and they increase their exercise, they're going to improve some, but not as much as the person who's here and improves because the slope is so much steeper. So the best thing you can do as far as exercise is go from sedentary to mildly active. Mild to moderately active, even better. Moderate to high intensity, even better. You get both an LDL drop and an HDL increase with cardiovascular exercise. One trick of the trade that I've learned as far as recommending exercise for my patients is to talk about the intensity in terms that is easy to understand. And so oftentimes we talk about heart rate max, and 80% of your heart rate max is when you know you're at a good rate. And there's a lot of specific things with exercise, and it can be really hard to wrap your mind around that. And so I like to tell patients that in order to ask yourself, am I exercising hard enough? A good question is, am I able to have a comfortable conversation in my current state? So if you're going for a stroll in the park with your partner or with a friend or something, and you're strolling along and you're having an enjoyable conversation without any difficulty, it's great that you're walking and it's better than nothing, but that doesn't count as cardiovascular exercise. If you want to count it as exercise, your heart should be fast enough and your breathing should be hard enough that it would be hard to have a comfortable conversation. And so that's why I like to tell patients to push themselves so that they're in that state with a fast heart rate and breathing, so that conversation is difficult. You go from never doing that to doing that 20 minutes a day, 4 or 5 days a week, you can see an appreciable difference in your cholesterol levels. So lifestyle adjustments for cholesterol are pretty straightforward. Improved diet, so you want to decrease the F's, decrease the fat, decrease the fried, and decrease the fast foods. And then for exercise, you want to get 20 to 30 minutes a day so that you can't have a conversation because you're breathing too hard. So those are the 2 lifestyle things that I recommend. Good evidence that that's going to help your lipid panel, your cholesterol numbers. And so I hope that's helpful. This is Dr. Stokes for Bread and Butter Primary Care. Have an enjoyable night.